The next topic in the reproductive system is looking at the female anatomy. For this topic, you should be able to identify and explain the function of ovaries, fallopian tubes, the uterus, the endometrium, vagina, vulva, follicle, ovum. Be able to describe the process of oogenesis, which is formation of eggs, describe the role of hormones in female sexual reproduction, and describe the physical and chemical changes related to the ovarian cycle, the uterine cycle, menstruation, fertilization, and pregnancy. There's a bit more detail in the female hormone section, so that's probably the big piece you'll spend time working on this unit. Again, we've got a diagram of female anatomy. Now, this is a lateral section, so cut kind of belly button would be up here. This is the butt cheeks. So orient yourself there a little bit. See if you can, before you go on, label any of these structures. And then as we move through the notes, go back and add any labels you can. Remember that this diagram includes structures from the reproductive system, as well as the urinary system and the digestive system.
The female reproductive system is made up of the external and internal genital organs. The breasts are also sometimes considered part of the reproductive system. The vagina is a tube-like muscular organ that connects the external genital organs to the uterus. It is the passageway for sperm to reach the egg in the uterus, for menstrual bleeding, and through which babies are delivered during birth. The uterus is a thick-walled organ in the middle of the pelvis that functions to support the developing fetus. Its muscular walls contract during labor to push the baby out, and the cervical canal widens to let the baby through. The two fallopian tubes extend from the uterus towards the ovaries, where eggs and the female sex hormones are produced. During puberty, the ovaries increase the production of estrogen and progesterone, causing a sequence of changes that include breast development and menstruation. The fallopian tubes are where the egg is fertilized by the sperm. The fertilized egg is propelled to the uterus by the hair-like projections that line the fallopian tubes. The female breasts are composed of milk-producing glands surrounded by fatty tissue. During the 24th week of pregnancy, a woman's body produces hormones that stimulate the production of milk, which is secreted by the glands and flows through ducts and out through the nipples.
The external anatomy of a female together is called the vulva. So these are the external genitalia, and it includes the labia, which are the folds of skin that surround the urethral and vaginal openings, as well as the clitoris, which is the organ of female arousal and has a similar embryological origin as the head of the penis. The labia, there are two pairs of them. The majora is the outer, sort of fleshier fold, and then the minora, labia minora, is the inner folds that surround the openings. You can see here a female body has three openings: the anus, which is the opening to the digestive system, or really the exit of the digestive system, the vagina, which is a reproductive opening, and the urethral opening, which is the exit for the urinary system. So different than the male, where the reproductive and urinary system both use the same opening, in a female, those are two different openings. On the internal anatomy of a female, the gonads are the ovaries, and these are paired organs found in the upper pelvic cavity. This is where immature oocytes are stored, and a female will have all of those oocytes, the precursor to the egg, before she is even born. So in utero, as a developing embryo, an individual will produce these primary oocytes, the cells that will eventually develop into eggs. Once a female reaches sexual maturity, around puberty, early teens, those eggs begin to mature one at a time, sometimes two at a time, every month in the process of egg maturation, and then are released as ovulation occurs. Ovulation is when an egg is released and starts to travel down in anticipation of fertilization. Now, fertilization doesn't occur. That's where then menstruation is the next step. Also on the internal anatomy, we've got these fallopian tubes. So these are the tubes that lead from the ovaries into the uterus. They terminate with these finger-like projections called fimbriae, and as the egg is released, they sweep the egg into the tube for it to travel down. Just like in other tubes and tracts in our body, cilia and peristaltic contractions move the egg towards the uterus. It is here in the fallopian tubes where we typically have fertilization occurring. And you can also see down here that it's actually not a very tight seal. The ovary releases an egg into this empty space, and those fingers try and catch it and bring it into the fallopian tube. This occurs fairly regularly, but there are occasions where an egg may drift out into the pelvic cavity, and fertilization can occur out here, which will result in an ectopic pregnancy, a pregnancy outside the uterus. Now, the uterus, or the womb, is a thick-walled muscular organ. In an individual that is not pregnant, it's about the size of a small pear. It's not a very large organ, about 5 centimeters in size. As a fetus grows, it can stretch to accommodate a growing baby and get up to 30 centimeters in size. It has 3 layers. The inner layer is an endometrium, and this is a thick, spongy layer with many blood vessels, and it provides nourishment to the implanted embryo. It is also built up and flushed out every month. So in preparation for a potential fertilization event, the endometrium thickens, becomes gorged with blood, to be available to nourish an implanted embryo. If implantation and fertilization does not occur, then it's all expelled. The middle layer is a layer of smooth muscle. And so this is what is used to actually deliver the baby. The contractions a woman feels in labor are the squeezing and contracting of the uterine muscles. Helps to push the baby out. To a smaller degree, we also depend on those muscle contractions to expel the endometrium during menstruation. And so menstrual cramps are really just tiny contractions to expel the endometrium. The middle layer also works in reverse to help assist the passage of sperm. During a female orgasm, the middle layer, or that smooth muscle, will contract and help to push the sperm further up into the uterus. The outer layer is a layer of connective tissue that helps to hold the organ in place. So you can see here that sheet of connective tissue kind of covers the body of the uterus, as well as the fallopian tubes and the ovaries themselves. They are all tucked in there. Not many of our organs are floating loose. You can see these ligaments here do help to support the uterus, which are particularly important as the uterus starts to grow and becomes quite heavy when it's pregnant. And so those ligaments are very important in supporting that structure. And you can also see down here at the base of the uterus, the opening to the vagina, which is the cervix. So the vagina, of course, is a multifunctional structure. It does facilitate intercourse. It's the site of penetration by the penis. It's also the birth canal. This is where the baby travels out, in most cases, on its way out into the world. And it also allows the passage of menstrual fluids. And now all of that is controlled by the gatekeeper. This is the cervix. And the cervix is similar to the sphincters we've seen around other parts of the body. It is a ring of tissue that surrounds the opening to the uterus. Typically, it is a very small opening. The opening itself is called the os, and it allows menstrual fluid out and semen in. That opening is typically millimeter or smaller. It's a very narrow opening just to allow the menstrual fluid out and semen in. As a female who is pregnant approaches labor, the cervix starts to soften, which we call ripening, and shorten. So you can see here, it's quite a long opening, and so that opening gets squeezed down as it widens and dilates to prepare for a wider opening, or os, to allow the baby to exit the body. When you watch a show, or if you've ever had any pregnant ladies in your life, and they talk about being 10 centimeters dilated, that's what they're talking about here, is the size of the opening of the cervix. 10 centimeters is about the size of a CD or a bagel. So that's the size the cervix has to stretch to accommodate a baby exiting. So you can see here, this is a cervix during most of pregnancy. It is long. It is mostly closed. It actually has a mucus plug in here, which is a protective barrier to help keep any foreign pathogens out of the womb. And it is, in this state, quite rigid or firm. Feels a little bit, if you were to poke the end of your nose, the tip of your nose, that's a not ripe or not softened cervix. As it reaches closer to the stage where the baby can be delivered, it softens and stretches and feels a little bit more like your cheek rather than the point of your nose. If you're really curious, this link here shows some photographs of cervix in different states, not just in leading up to labor, but also in different states of the menstrual cycle. It does change quite a bit throughout a female cycle. And if you've ever had a Pap test or heard of Pap tests, those are tests where a doctor will insert a speculum, a device into the vagina to allow them to see and swab the cervix. So they're testing for cells there that may be abnormal, can be an indicator of cervical cancer. So if you're curious, there's the guidelines about Pap tests for you